Good morning, everybody. My name is Cheryl Martin. I'm the Director of Public Health Planning at the Ministry of Health, and I'm going to be your Master of Ceremonies for the next 2 days. So welcome to the provincial expansion of Seek and Treat for Optimal Prevention. This is the Phase 1 of knowledge exchange, and we are very, very thrilled to have all of you here. I'd like to start by acknowledging and thanking the Coast Salish people on whose traditional territory we are holding this event. And at this point in time, I'd like to ask Shane Pointe to come up and open our event. Shane. So Shane is a member of the Musqueam First People. His ancestral name is T-Teya, and Shane has been educated in Coast Salish language, culture, and ceremonies, and has practiced these for his entire life. Shane has learned some of the history and ceremonies of his Nuu-chah-nulth bloodline, and has had the opportunity to learn the culture and ceremonies from other language groups. Shane's motto is Tswe Nutsa, we are one. Please join me in welcoming Shane Pointe.
Good morning. When I was a much younger man, moving through the world with my dear and close friend, Jerry Ullman, we used to do facilitation at workshops for youth, encouraging them, inspiring them to be healthy, to get education. And during that time, we bumped into a kid who had gone to see one of our uncles in Duncan to learn language, culture, and ceremony. And he'd travel around to these youth conferences as well. And at the time, he was an ambassador to young people for health. And he had this huge smile. And we'd met him, and we talked to him a couple of times, and we'd go to these conferences, and he'd be there. And during conversation, I caught on really quickly that this young man was not only doing this to help himself, but to help young people, to encourage them to language, culture, and ceremony, and that he was an actor as well. But in speaking to him, it was really clear to me that this young man was a genius. And I couldn't, for the life of me, figure out why he was wasting his time being an actor when he had this immense intellect that could help us far beyond being able to see him on screen. And of course, lost touch with him for many years. And I bumped into him one day, and he said, "I'm a doctor." And I thought he was joking because he has such a wonderful sense of humor. And he went, "Oh, I'm a doctor." And I looked at him and I laughed, and I went, "No way." And he says, "Yeah, I'm an actual doctor." And I went, and I was so happy because the young people in our community, in our communities, benefit from him being a medical doctor. He showed us another way. And for me today, when I see Evan, I'm so happy in my heart.
Thank you, Shane. Okay, at this time, I would like to introduce Arlene Paton. Arlene is ADM of Population and Public Health. Arlene has worked for the provincial government in Victoria since 1988 and has held a number of posts in Ministry of Finance, Advanced Education, and Aboriginal Relations and Reconciliation before she came to us at the Ministry of Health, and we're very thrilled that she's with us. Arlene holds a Bachelor of Arts from the University of Manitoba and a master's degree in public administration from Queen's. So please join me in welcoming Arlene. Don't fall off the back. Okay, I'll just sit down now.
So thank you, Cheryl. Sorry about trying to push you off the stage. And I have to, first of all, apologize for my voice. I have been losing it over the last couple of days. I actually feel fine, so this is purely a sympathy vote, I think, to try and get you to be happy to see me. But I do apologize because I think it's pretty painful for you to listen to me this morning. But I really wanted to be here to welcome all of you because I think this is just such an important initiative. I was so pleased to hear our elder Shane Pointe speak this morning about coming together as one and one with Mother Earth, and just how that grounds us in understanding how we need to operate as a health system, and a health system that's beyond healthcare and into communities and into First Nations communities, non-Aboriginal communities, different communities that need our support, our compassion, as well as our knowledge and our ability to address this epidemic of HIV/AIDS and to build on the huge successes that we have. So thank you very much, Shane, for starting us in such a good way, particularly like the stories about Evan. I wasn't going to do this, but Evan just smiled at me, and it reminded me when I first met Evan was at a conference in Prince George, and I didn't know him, and I didn't know he was on TV, and he was a doctor then, and he was doing a presentation about health human resources. I was working at the Ministry of Advanced Education at the time, and it was an event to encourage the system to have more Aboriginal students. And behind me, there was a row of Aboriginal women, and they were all going, "Oh, isn't he cute? Oh my, I'm going to go and get his autograph." And I was thinking, who is this guy? And now I'm just so thrilled that he's our deputy provincial health officer, and he works down the hall from me, and we're having a great time together. He also, of course, spends time with the new First Nations Health Authority, and I'm really pleased that they're going to be here today and tomorrow, and presenting on some of the work they're doing in HIV/AIDS and how they need to be a strong partner in the process that we're embarking on in this provincial expansion as well. So I think it's great. So again, I'd like to acknowledge that we are meeting today on the traditional territories of the Coast Salish people, and particularly the Musqueam, and how wonderful it is that all of you have traveled here today with your hearts open and your minds open, eager to share the lessons learned from the pilot, and eager to receive that learning and apply it to your situation in all corners of the province. I'd also like to thank all of those who are presenting and facilitating and coordinating. I know my team has worked hard to bring this together very quickly. And I know it's going to be hard work. I think we need to acknowledge that change is always hard, and there's always going to be people putting up barriers and people thinking, well, we should try this instead. But wait a minute. The Northern Health already tried that, and it didn't work. We got to learn from those lessons and apply them differently. And all health authorities are challenged here. I want to acknowledge that even though BCH, Northern Health, Providence, the BC Centre for Disease Control, all of them have been participating in the pilot, but not necessarily in all corners of their regions and their activities. And so even though they willingly gave up some funding so that the 3 other health authorities could have some seed money to redesign their programming, just as they had received money through the pilot. I'm losing myself in this very long sentence, but I want to acknowledge the fact that we in the ministry actually didn't have a hard time asking VCH, Northern Health, Providence, the Centre for Excellence in HIV/AIDS, and who am I missing? PHSA, to give up a few bucks in order that there would be sufficient dollars for the 3 new health authorities to engage in this provincial expansion. So I want to take my hat off to them and acknowledge that. And I know that Interior, VIHA, and Fraser are all very excited that they actually have some resources to make real change on the ground and do that redesign. So I appreciate that. It's forging those new partnerships that's going to make all the difference. I know Julio is going to get up and speak this morning, and there's this beautiful slide. I don't know if it's in your presentation, but it's showing that diagonal line, what we call kind of diagonal thinking about making sure that we're looking at all parts of the healthcare system and moving the indicators in all parts of our system. So it's not just public health, it's not just acute care, it's not just frontline physicians on the ground, it's not just in community, it's all of those things together, and that's what made the pilot so successful and so strong. He's also, I'm sure, going to talk about the cascade of care, which I've also had a private tutorial on from Julio, and it's very exciting to think about disease in that way, and so I hope you'll enjoy that presentation. So incorporation of treatment as prevention into our response challenges the way we've approached HIV for the last 30 years, but we've come a long, long way since the beginning of the epidemic, and it's so fascinating to see those indicators, those graphs show BC from being at the height of the epidemic and being the highest in Canada across all the provinces and coming down to sort of the middle of the pack, I guess, so that's fantastic. Unfortunately, we all have also seen Saskatchewan go way high, and so we know that if we don't take these steps, that we could be in that boat if we're not consistent, if we're not effective, if we're not constantly watching those facts and figures and that data, which Julio and his team at the Centre for Excellence does such a great job at presenting to us over and over and over again on a monthly and quarterly basis. I think I could give his presentation. So this knowledge exchange is the kickoff. It's not the end of the process to support all of you in this learning journey. And I also want to say that the Centre for Excellence has the HIV Quality Improvement Network, and many of you are already members of that. So this process over the next couple of months, maybe into the new fiscal year, is to just kind of kickstart this and help you think about how to redesign programs and services. But that's the area where you can continue to learn about the latest research, the latest data, and we hope to be able to share the stories and successes across the province through the network in the months and years ahead until, in fact, we do reach that point of an AIDS-free generation. I should also mention that for many of you probably weren't at the announcement on, I think it was November 30th, Ministers McDermott and Sultan announced that we were doing this provincial expansion and that the pilot was going to be an ongoing provincial expansion for Stop HIV/AIDS and treatment as prevention, being fundamental to that. And it was a fabulous event, and I think that just shows us the political commitment to this initiative, and that they also will be wanting to see that the successes of the pilot are expanded across the province. So this is a pretty laudable, lofty goal, an AIDS-free generation, and I hope that you feel that this is somewhat historic, that we're starting here in BC to really focus on what we've learned over the last 4 years, what the Centre for Excellence has led us to understand, and has led the world to really change its views in this area. And Dr. Julio Montaner has been all across the world spreading his research and understanding of this. And we are very lucky in BC to have him here at the Centre for Excellence. And I think it's fabulous that we are also probably taking this first province-wide expansion in anywhere really in the world. So again, it's a very historic thing. So with that, I just apologize again for my terrible voice. I don't usually sound like this. It sounds like I've been smoking a couple packs a day, which is not true. But now I'd like to turn it over to Cheryl, who will take folks through the goals and milestones laid out in the strategic framework. This framework, I'm hoping you all have it. It is up on our website and was developed with the, I'm going to get the name wrong, the Stop HIV/AIDS Pilot Steering Committee. And it has in it the targets that we're hoping all of you will help us accomplish as a province. And he'll walk you through that. So thank you very much, and good luck with the work ahead of you over this next 2 days and over the next few years. Thank you.
Thank you, Arlene. While Ciro is just queuing up his presentation, I will, oh, never mind, it's queued up. Okay, here we go. So Ciro Panessa is the Director of Bloodborne Pathogens at the in Population and Public Health Division within the Ministry of Health. And in this role, he stewards the implementation of strategic policy and the monitoring and reporting of outcomes for communicable diseases, including HIV, viral hepatitis, and TB. Ciro completed his master's in nursing in 2005. He's an adjunct professor at the UBC School of Nursing and is a practicing family nurse practitioner. So please join me in welcoming Cheryl.
Thanks, Cheryl. And yeah, I don't think I'm ever going to be able to thank people enough for all the work over the last 4 years with the pilot, the people that have worked tremendously hard to get this event off the ground so quickly, and in the coming years as we move from a pilot to a provincial program. So just going to spend a few minutes before we turn it over to Julio to talk about shortly after the minister's announcement around provincial expansion. The ministry released a policy framework to provide strategic guidance around that, from hope to health towards an AIDS-free generation. An AIDS-free generation. I just want to take a moment to pause and for us to just sort of think about what that means. And at a high level, it means no children are going to be born with the virus, and that's something that we already do tremendously well here in BC at ensuring. As these children become teenagers and adults, they'll be at far lower risk of becoming infected. And for those living with HIV, they'll be diagnosed early through regular testing offers and be offered prompt, comprehensive care, treatment, and support so that no one dies of AIDS. As we've alluded to, the purpose of the document is really to provide that strategic guidance around transitioning from a pilot to a provincial program, basically moving forward from the 4-year pilot that occurred in Vancouver and Prince George, and really now fundamentally shifting, taking that knowledge, taking the science of treatment as prevention, and incorporating it into our response. There really is a focus in the document on trying to not reinvent the wheel, taking those lessons learned, taking those successes, and so people don't have to start from scratch. The document outlines goals for the provincial program. They're very similar in many ways to the pilot. Reducing the number of new infections, improving the quality, effectiveness, and reach of HIV prevention services, diagnosing people early, improving the quality and reach of support services for those living with and at risk, and over time, reducing the burden of advanced HIV infection on the health system. The document also contains broad milestones for achievement, as well as some specific targets around harm reduction, testing, diagnosis, care, and treatment. Essentially, through routine offer and targeted approaches, we're looking to increase the reach of HIV testing. We want to normalize it. We want to diagnose people early in the course of their infection. We want to give people the opportunity to engage in care before the disease progresses. We want people living with HIV to live longer, healthier lives, and for no one to develop an AIDS-defining illness or to die of AIDS. And of course, we want to maximize the individual and population-level effects of HIV treatment and the engagement and support that goes along with that to try and get everyone who's willing and medically eligible on therapy. In the end, this provincial expansion, we want results for people, for British Columbians. Julio will talk a lot more about this cascade of prevention and care, but in the end, we're wanting to drive improvements in it. On the far left, we want to reduce the number of people at risk or that are contracting HIV in the first place. For the other areas, we want to reduce the gaps. We want to raise the bars up, and we want to make improvements along all steps of the cascade: testing, diagnosis, care, and treatment. And as you'll see in Julio's presentation, this cascade is going to be a foundational framework for monitoring success here in BC. And as Arlene alluded to, there's results for the system too. The STOP pilot, the STOP program, the diagonal approach. It's becoming clear that STOP is improving collaboration and integration within the system. And as we move forward, in particular, I think it provides us some really interesting opportunities. And in many ways, it feels like the tip of the iceberg. For example, is the work that we're doing to get providers throughout the system to offer HIV testing. Does it provide better opportunities to engage folks with other STIs, for viral hepatitis? What does the future hold there? There's going to be a whole plenary on proportionate universality tomorrow, so not going to go into any kind of detail. But the pilot has certainly taught us that there are multiple pathways into testing and care that assist those with vulnerability throughout the population to engage with the system. Essentially, following the principles of proportionate universality will ensure that we achieve equitable outcomes for all, and are really found that those principles are foundational to the universal testing and treatment aspects of the STOP program. It also outlines 5 guiding principles: continuing to recognize and address stigma and discrimination where possible, as we know that continues to be a major barrier in us achieving improvements in the cascade. Shifting the system from one that no longer or is less about passively waiting for people to access the system, but is proactively reaching and engaging folks. A program that involves community. We would not be where we are today without the efforts of community, without the years of dedication, many who are living with HIV, some who have died of AIDS. And as Arlene alluded to, one that engages Aboriginal people, that takes advantage of some of the historic governance changes that have happened in the province with the Framework Accord and the Health Plan, partnering with the First Nations Health Authority. And of course, this isn't a mandatory program. This isn't about forcing people against their will to do anything. We are still wanting to ensure consent, informed consent into testing and care. So really looking forward to the next 2 days. I think hopefully everyone finds it extremely helpful as we're making this transition. Looking forward, it's really just the start of a dialogue. Looking forward to the follow-up sessions that are going to need to occur after this. The start is coming up soon in April, and looking forward to seeing where we go towards an AIDS-free generation, hopefully. Thanks.